So, today's topic is on Roy's adaptation model RAM. So, let's see a brief about Sister Callista Roy. So, Sister Callista Roy was born in Los Angeles, California on October 14, 1939. She was the second child of Mr. and Mistress Fabine Roy. Her mother was a licensed vocational nurse. Roy was designated as a 2007 Living Legend by the American Academy of Nursing. So, we'll see on her education. She did her bachelor's degree in nursing from Mount St. Mary College in 1963. She even did her master's in pediatric nursing from University of California in 1966. She was suffered with encephalomyelitis, a neurological disorder where she had inflammation, where there is inflammation of brain and spinal cord, which leads her to confusion, seizure, and even she have headache and weakness. Beside this beside this problem, she even did her second master's and PhD in sociology in 1973 and 1977. Dr. Roy also had the opportunity to be in a clinical nurse scholar 2-year postdoctoral program in neuroscience nursing at University of California. So now we'll see her professional experience. So the first in professional experience, she started at age 14 as a nursing aide, which provides basic care and services to the people. And she did her pediatric nurse. She was a pediatric nurse, nursing instructor in many different capacities. She has lectured across the United States and in more than 30 countries. She also studies the role of lay study in recovery from mild head injury. So now we'll see the influencing factor. The influencing factor are family, education, religious background, mentors, clinical exposure. So because of this influencing factor, she thought of because of all these influencing factors, she have adapted the model, the Roy's adaptation model. So let's see the theory description. The central questions of Roy theory are, in her theory she have asked us some questions. So we'll see: who is the focus of nursing care? What is the target of nursing care? When is nursing care indicated? So these are the questions that have arises in theory, that have arises in her model. So after Roy ideas appeared in a graduate paper written at UCLA, University of California in Los Angeles in 1964, and she published her idea in Nursing Outlook in 1970. So subsequently, different components of her framework of her ideas crystallized during 1970s, 80s, and 90s. So over the years, she identified assumptions on which her theory is based. So in her theory, she have put on some assumptions. So the assumptions are explicit and implicit. So first, let's see the explicit assumptions. So explicit means like an assumptions that stated clearly in detail, that leaves no room for confusion, no doubt. So let's see, the person is a biopsychosocial being. The person is in constant interaction with a changing environment. To cope with a changing environment, to cope with a changing world, a person uses both innate and acquired mechanisms, which are biological, psychological, and social in origin. So health and illness are inevitable dimensions of the person's life. To respond positively to environmental changes, the person must adapt. The person's adaptation is a function of the stimulus he is exposed to and his adaptation level. So here what happened is that as the person is a social being, uh, the person needs to have a constant interaction with the environment. Like when the environment is changed, the person should know that, oh, because of this environmental change, I need to cope up, I need to adapt, I need to cope up with the change in the environment. So like the adaptation, the mechanism may be innate or acquired mechanism, which are biological, physiological, psychological and social in origin. So to respond positively to the change in the environment, the person must able to adapt. So the person adaptation is a function of the stimulus he is exposed to and his adaptation level. So with the change in the stimuli, with the change in the environment, the person should know how to adapt. So these are the explicit assumptions. So now again we'll see some more points. The person's adaptation level is such that it comprises a zone indicated the range of stimulation that will lead to a positive response. The person has four modes of adaptation: physiologic needs, self-concept, role function, and interdependence. Nursing accepts the humanistic approach to valuing other person's opinion and viewpoints. Interpersonal relations and the integral part of nursing. There is a dynamic objective for existence with ultimate goal of achieving dignity and integrity. So here what happened is that in order to adapt with the situation, the person should have four modes of adaptation, like the physiologic needs, self-concept, like the physical self-concept, role function, and interdependence. So so these are the four modes in order to adapt the situation, in order to adapt the stimuli, in order to adapt the environment. So next is the implicit assumptions. So what are implicit? Implicit means any underlies logical argument, a course of action, decision that is not expressed, and that may go undetected. So every explicit assumption uh, lies an implicit assumptions. So it is the implicit assumption is hidden inside the explicit. So we'll see a person can be related to parts for any study and care. Nursing is based on casualty. Patients' value and opinions are to be considered and respected. A state of adaptation frees in individual energy to respond to other stimuli. So these are the implicit assumptions. Now we will see the Roy adaptation model. So in Roy adaptation model, RAM, she focused the interrelatedness of four adaptive systems. So it is a directive theory based on nursing practice. She have adapted this theory based on nursing practice. So the RAM guides the nurse who is interested in physiologic adaptation, as well as the nurse who is interested in psychological adaptation. So the person who needs a physiological adaptation, like physical adaptation, and a psychological adaptation means like thinking, like we as a nurse, according to this day to day day-to-day activity of a nurse. Like we used to have like duty, we used to have stress. In order to cope this stress, roy has sister roy has adapt a model that is a roy adaptation model. So she focus on four modes. Let's see. The modes are uh, meta-paradism. So meta-paradism means a set of ideas that provide structure for how a discipline should function. Like this, these are the modes that develop the theory. So the first one is the person. The person or a group view as an adaptive system, their health and their environment. Person also refers to families, groups, communities, and the whole society. So the person doesn't mean only a specific human being, only a specific person, only a one person. So person means the whole society, the families, the group of people in the whole world. So as in this person, what happened is that we in this theory we have to know a person properly, whether the person is healthy enough, whether the person have positive thoughts, all these things. So after knowing the person properly, we have to know the person health status. Health is a state and the process of being and becoming an integrated and whole person. It is a process of where he or she is striving to achieve their maximum potential. So in order after knowing the person properly, we should know the person health status. So after whether the person health status is healthy enough or needs any special attention. So after this we'll be seeing the environment. So Roy sees the environment as well as the conditions, circumstances, and influences that surrounds and affects the development and behavior of the person. A change acts as a stimulating and causes adaptive responses. So after knowing the person health status, we have to know the person environment. The environment doesn't mean the surroundings like birds, natural nature. Like environment means the patient surroundings, like people, like any problems, like any situation, like any stimuli. Next is the nursing. After the person have is healthy enough and able to cope the existing environment, uh, for example, like the person is the person health the person is having a health problem, so he or she is admitted to the hospital. So the hospital environment and the home environment, it's different. So the person might have problem in coping up the hospital environment. So after having a adjustment with the existing environment, the person is able to cope with the environment, so the person is ready for any treatment. So we as a nurse, we also should have an interpersonal relationship. We should have a good interpersonal relationship with the patient, so that while any procedure, the patient will cooperate. Next is the coping mechanism. So the first one is the regulator, coping mechanism which responds automatically through neurochemical endocrine system. So when we have a problem, uh, we just cope it automatically to uh, in order to cope that problem. So like regulator means like it is a mechanism that copes automatically without any thinking. We just used to able to cope up. We are able to adjust with the existing environment, like it just occurs automatically. Next is the cognitor. So coping mechanism which responds to complex process of perception and information processing, judgment and emotion. So in this cognitor, as it is a complex process, we need to think properly how to react on this, how to react with the existing stimuli, how to react with the change in the environment. So these mechanisms are used by humans to cope with stimuli from the internal and external environment. With the changes in the internal and external environment, these coping mechanisms are used by the humans. Next is the stimuli. So there are various types of stimuli. First, let's see, adaptation level is a constantly changing point made up of focal, contextual and residual stimuli influence the individual's ability to cope with the environment. So in order to cope with the environment, so we have to know what kind of stimuli are they. So let's see, types of stimuli. Focal stimuli that immediately confront the individuals in a particular situation. So it just like confront, like focal stimuli means it just confront immediately, like it just happens immediately without any underlying knowledge, without any underlying things. It happens automatically, it just comes face to face. So next is the contextual stimuli. So in contextual stimuli, it has an underlying cause, it has an underlying effect. So from that underlying effect, it occurs again, it arises one more effect, that is the contextual stimuli. Next is the residual stimuli. Includes the individual's belief or attitude that may influence the situation. So in residual stimuli, like the person will have a strong belief with the attitude that may influence the stimuli. Like the person have a strong belief, how to with that strong belief, the person have that influence, the because of that strong belief, the person is able to cope with the existing stimuli. So these are the types of stimuli. Next is the responses. Adaptive responses, responses that promote integrity of the persons in terms of goals of survival, growth, reproduction and mastery. So in order to cope with the stimuli, the person need to respond. So in adaptive responses, responses that may promote integrity of the person in terms of goals of survival, growth or reproduction and mastery. So the responses may be in the form of goals of survival, growth, reproduction and mastery. So if the person are able to respond in that specific things like the goal of survival, growth, reproduction and mastery, then the person will able to adapt. So this is the adaptive response. So adaptive response means the person who can respond positively with this specific situations. Next is the ineffective response. In ineffective response, what happens? Responses that do not contribute to adaptive goals, like the person is not able to respond to that adaptive responses like the goals of survival, growth, reproduction and mastery. So as I have above mentioned the adaptive responses, let's see what are the adaptive modes. The first one is the physiologic, like physical, oxygenation, nutrition and elimination, activity, rest and protection. Like we need to have a healthy physique, we need to have a healthy like physical, not only physique, like a surrounding, we need to have a healthy life. Next is the self concept, like we need to have a positive psychological and spiritual elements. We need to think positively, we need to have a we need to have a positive mindset. Next is role of functions, primary, secondary and tertiary roles the person performs in the society, whether be it any small or like any huge events or any like situations. The person should able to cope with the each and every sections of life, where each and every segments of life, each and every changes in life. So next is the interdependence, coping mechanism arising from close relationship. So in order to cope with the situations, the person should have an interpersonal relationship with the person himself or herself, and plus with the environment, plus with the surroundings, the families, the friends, the society people, and even to the environment. So this is the Roy's adaptation model. So let's see, in this adaptation model, the stimuli, the blue circle is the adaptation level. So the stimuli, when any of the stimuli, like um, when any of the stimuli has arises to a person, has arises like it had come to the person, like, so the person should have a coping process, like physiologic, self concept, interdependence, role of a function. So with this coping processes, if the person can um, react positive to that stimuli with this coping process, then the person behavior, then the person will able to adapt with that stimuli, and will can go on further, um, to further with the adaptation level, like the person can have a positive mindset, can have a positive health, can have good coping mechanism with the existing environment, with the people. Next is, if with that stimuli, with that arise in the stimuli, if the person cannot able to cope with this coping process, then the person will not be able to adapt. Like for example, the coping process, like the physiologic, self concept, interdependence, role function, if the person is not able to use all this coping process and able to, and if the person is not able to adapt with this stimuli, then the person behavior will be will change. Like the person will have a negative mindset, the person will have negative thoughts upon other people, the person will not be able to cope up with the existing environment. So this is a brief the diagram of Roy's adaptation model. So Roy's adaptation model, a system model. Roy adaptation model is a system model that focus on the outcomes. The major features of the system models are the system and its environment. A system is a set of parts that connects to function as a whole for some purposes and are interdependent of its part. A system is characterized by input output control and feedback processes. So sister Callister Roy has adapted a model, Roy adaptation model. So she focuses on the outcomes, like the feedbacks. So according to the feedbacks, she will be able to know whether her model has a positive outcome or not. So she focuses on the outcome, like the feedbacks. So in her model, it consists of the input output control and feedback process. So now let's see. So first thing is the input. Input, like any stimuli. So if the stimuli For example, a stimuli have arises to a person, like any changes that arises to a person. So after arising the changes to a person, to a human being, to a person, so the person should able to cope the mechanisms by using a regulator, like um, a regulator or a cognator. So after the stimuli has come, after the stimuli have arises, the person should have a coping mechanism, be it a regulator or a cognator. So after doing this, the person will have a control process, like the physiological, like the role functions, self concept, or the interdependence. After controlling all these effectors, the person will have an outcome, like a positive outcome. The person will have a positive mindset to the changes of the stimuli. So after a positive outcome, the person will react to the stimuli, that is the feedback. Okay, so for again I'll be repeating. So in the input, a stimuli will arise. So after arising that stimuli, it will go and react to the person, to the person coping mechanism, to the person. So the person again will react, like the person coping mechanism process will start, whether be it a regulator or a cognator. So after this coping mechanism, the person will have some effect, some changes in the physiologic functions, control role of functions, and interdependence. So after this, if the person is able to have a positive outcome, a positive if on the a positive effect on this all the factors, then the person will have an output, that is the adaptive and ineffective responses. So after having a positive thought, after having a change, positive mindset in the change of the stimuli, the person will react to the stimuli, that is the feedback. So this is a so after this, let's see application of the 4 adaptive models on nursing process. So this model we can apply to the nursing process, that is the assess of behavior, assess stimuli, nursing diagnosis, goal setting, intervention, and evaluation. First one is assessment of behavior. So the first step of nursing process, which involves gathering data about the behavior of the person as an adaptive system in each of the adaptive modes. So assessment of behavior means, like, that is the first step of nursing process, where we will assess the person behavior, like how the person will collect all the data of the person. So after collecting all these behaviors, the person data will be go to the assessment of stimuli. The second step of the nursing process, which involves the identification of the internal and external stimuli that are influencing the person's adaptive behavior. It may be number 1, focal stimuli, contextual stimuli, and residual stimuli. So after assessing the behavior, we can again assess the stimuli, like what are the main underlying cause that hampers the person health, that hampers the patient's health. So what let it may be a focal stimuli, it may be a contextual stimuli, it may be a residual stimuli. Like focal stimuli, like it a disease condition that happens suddenly, a disease that happens suddenly. For example, let's talk about coronavirus. Like in coronavirus, some patients may have sign and symptoms, and some persons might not have sign and symptoms. So the person who is not having some underlying sign and symptoms, they are the focal stimuli. Like it just happens without any alarming effect. So that are the focal stimuli. Next is the contextual stimuli. Like contextual stimuli, the person will have an underlying disease condition, for example diabetes mellitus. So because of lack of care, because of lack of diet and proper health care, the person will have uh, some complications like retinopathy. So that is an example of contextual stimuli. Like because of some stimuli, again one more effect arises, that is the contextual stimuli. Next is the residual stimuli. Those stimuli whose effects whose effect on the situation are unclear. Like there is no clear effect, like the underlying cause is not clear, like how we can't the cause is not clear, like the main effect of this stimuli is not clear. That is the residual stimuli. Next is the nursing diagnosis. Step 3 of the nursing process, which involves the formulation of statements that interpret data about the adaptation status of the person, including the behavior and the most relevant stimuli. So like next step is the nursing process. After knowing the stimuli, the nurses can formulated a diagnosis. That is like that is the nursing diagnosis. Like we can formulate the according to the stimuli, we can formulate a nursing diagnosis. Like we can know the patient's condition. Next is the goal setting. After knowing the patient condition, we can set a goal, like what are the steps that need to be taken up in order to give a proper care. So that is the fourth step of nursing process. Next is the intervention. So after knowing the set of goals, after setting the set of goals, we will intervene. We will give the care to the patient. So that is the fifth step of nursing process, that is the intervention. And lastly is the evaluation. So in evaluation, we will evaluate the we will evaluate the evaluate the care that we have given, like whether it is a positive care or whether the person health status is improving or not. So as a brief, I will explain it. So the relation between the nursing process and the Roy's model is that, like, there is a stimuli. So in that stimuli is the person health. So after that stimuli, the person will have a coping mechanism. That coping mechanism is the assessment of the stimuli. So after assessing the stimuli, let's see, that is the nursing diagnosis. Nursing diagnosis is the factors, like the physiologic, like the functions, the self-concept. So after knowing the functions, after knowing the effectors, we can set the goal. So the goal settings, after setting the goals, we will intervene. The intervene is the process where we can reduce the effects, like the stimuli, like the patient's problems, the conditions. After intervening, we will evaluate. So interventions, it's after interventions we will evaluate. Evaluate is the outcome, that is the feedback. So there are some examples of Roy model applied in practice, like for cancer patients, amputation, occupational hazard, education in geriatric nurse practitioner program, administration, nursing, philosophy, standards of practice, job description. So not only this Roy's model can applied in nursing process, it can also applied in different field. It can be applied in practice, education, administration. So this is a short description about this is all about Roy's adaptation model. So now we will come to the conclusion. Widely used in different settings and has enduring property, updated as knowledge increases and trends change. As one of the weakness of the theory that application of it is time consuming, application of the model to emergency situation requiring quick action is difficult to complete. So um, this tells us that like this Roy models, not only it can apply to nursing process, it can apply in wide variety of range. It can be applied in practice, educator, administration. So it is according to the changes in time, the Roy's model is according to the updated knowledge, there is an increased trend in the change, like there is an increased trend in the goal setting, in the intervention. So this is all about Roy's adaptation model.